Hello. Good morning, everyone. Thank you for joining us today. We will start in 10 minutes. Thank you. morning, everyone. May we request everyone to please move forward. Please occupy the seats in front before we start our program. Yeah, maybe request everyone, please, if you may move forward. Kindly occupy the seats in front, please. Thank you. All right. Hello. Okay. Good morning to our speakers and distinguished guests from the government, patient groups and civil society organizations, medical societies, pharmaceutical industry and associations, the academe, and other stakeholders from the health sector. I am Joyce Ilas. I am the Communications and Advocacy Lead of Strat-based ADR Institute, and I will also be your host and moderator for today. Welcome to the forum on Achieving a Nation Free of Cervical Cancer, launch of the Philippine Cervical Cancer Elimination Movement. Now, this event is organized by the Strat-based ADR Institute in partnership with JPIGO Philippines, Cancer Coalition of the Philippines, and Universal Healthcare Watch. Now, this is a hybrid event, so thank you very much to everyone who is here with us today in the venue. And also, thank you to everyone who is with us via Zoom and to those who are also watching us via Facebook Live. So, May is the Cervical Cancer Awareness Month in the Philippines. But just how much do we know about cervical cancer? Did you know that in the Philippines, cervical cancer is the second most frequent cancer among women, next to breast cancer with about 8,000 new cases diagnosed each year? Did you also know that almost 11 women die of this disease every day? This means every 2 hours, a family will lose a wife, a mother, a daughter, a tita, a sister, or even a friend. And this is projected even to increase every year. And did you know too, I'm sure many of you know, that these could all be prevented. So this is why in this forum, we gathered key stakeholders to discuss evidence-based and cost-effective interventions that will scale up the elimination of cervical cancer in the Philippines, and also to officially launch the Zero Cervical Cancer movement. So to formally open our event today, may we call on the President of Strat-Based ADR Institute, Professor Victor Andres Dindo Manhit. Professor Victor Andres Dindo Manhit is the current president of Strat-Based ADR Institute and the managing director of the Bauer Group Asia in the Philippines. He served as associate professor and chair for the Political Science Department of the De La Salle University. He regularly contributes articles and columns on renowned news platforms like the Philippine Daily Inquirer and Business World. His expertise includes strategic studies and management, legislative research, and public policy analysis. Ladies and gentlemen, Professor Dindo Manhit. Let's give him a round of applause.
Thank you, Joyce. Good morning to everyone. Thank you for joining us. For those here with us in the venue, Discovery Premier, and for those who are live with us in Zoom, thank you for allowing to partner with us, to all our participants here, stakeholders, in this event, Achieving a Nation Free of Cervical Cancer. You know, back in May 26, 2016, 7 years ago, by tomorrow, Strat-Based ADR Institute gathered different key stakeholders, composed of health experts, medical professionals, civil society organization, and patients group to discuss issues regarding the implementation of a cancer control program. A significant output of the forum was the publication of a white paper, and which was then submitted to legislators, which is one of the key strengths of Strat-Based ADR Institute. We built our network initially when we established ourselves in 2004 with the Philippine legislature. I myself, I'm a former Deputy Secretary of the Philippine Senate and Chief of Staff of a Senate President before that. And we used that network to push this initiative. And that particular paper resulted in the filing of bills by legislators from both houses of Congress. A good friend of Strat-Based at a personal level sponsored it in the House. Friends and even my former student in La Salle, at the time chairman of the Senate Committee on Health, J.V. Ejercito, so it works to have students in the Senate, started advocating with us and resulted into the passage of the landmark law, the National Integrated Cancer Control Act, on February 14, 2019, a few days prior to the signing of the Universal Health Care Act. It was a long journey, but without the help of different stakeholders who continuously pushed for this advocacy, this would not be possible. In Strat-Based ADR Institute, we have always argued for what I call, when I hear public officials say whole of government, I tell them, in Strat-Based ADR, we believe in whole of society. The idea that public officials, public servants, work with the private sector, work with stakeholders, work with experts in pushing advocacies that is evidence-based and results-driven. But our journey and advocacy did not stop there after the passage of the law. Since then, we at the Institute continue the discussion by hosting different roundtables, town hall discussions, even at the height of the pandemic, we call virtual town hall discussions that tackle progressive implementation of both the NICA, the UHC law, and other health-related laws, true to the spirit of universal health care, that no one should be left behind. When people ask me, why do you do that? Just like 2 days ago, I was interviewed by reporters from the EU. Can you imagine Polish reporters interested in the Philippines? Swiss reporters. Because in Strat-based ADRi Institute, we always try to speak up, bring people together in key important issues of society. And I always tell them, we try to be good patriots, good citizens in the country. And we believe that having these discussions through the years, we saw that we've gained small but sure wins in the implementation of the health laws. When I was younger in the policy game, I used to be very aggressive, but maybe age brought me to, I'm a more incrementalist. One victory at a time, one step at a time, as long as you get your objective. In the case of the NICA, for the past 3 years, it has been funded in the national budget, which is very critical for the implementation of the law. For this year, a combined total of 1.56 billion was allocated for the implementation of the Cancer Control Program and the Cancer Assistance Fund. Given the sustained funding, we now see that we need also to focus our efforts to gradually eliminate cancer in the Philippines. Cancer is close to our heart, to my family. We lost our mom to cancer early in my young age, especially to my brother who is a decade older, a decade younger than me. We have lost aunties, people close to us through the years. And looking at recent data, we saw that cervical cancer remains to be the second most frequent cancer among women, next to breast cancer, wherein about 8,000 new cases are diagnosed each year. In 2020 alone, around 15 of every 100,000 Filipinas have contracted cervical cancer. Unfortunately, this mortality rate from this disease is still high. In 2020, the World Health Organization released a global strategy to eliminate cervical cancer. There's a vision of a world where cervical cancer is eliminated as a public health problem, following the 90, 70, 90 targets that hopefully would be met by the Philippines by the year 2030. There are laws in place. The question now is, are we set to achieve this target? The global strategy from the WHO emphasized the importance of partnership, advocacy, and communication to achieve the said targets in a given time frame. And that has been the strength of Strat-based since 2004. When I started to move out of the academe, focus my efforts in Strat-based, people were telling me, can think tanks, can research think tanks, can advocacy think tanks survive in the country? That was 2004. And here we are, working with partners, which is a true strength of groups like ours in Strat-based. The role of civil societies, women's groups, non-governmental organizations, and a wide range of local networks is fundamental to the successful uptake of services at the community level, as we have constantly been advocating multi-sectoral collaboration for mobilizing and sharing knowledge, expertise, technologies, and financial resources is crucial to support the achievement of sustainable development goals as committed by the Philippine government. We can overcome several challenges that impede access to and use of cervical cancer prevention and care through effective advocacy and communication strategies. In the mid-1990s, I introduced a course in De La Salle University as an elective. It was called Political Marketing, how to shape public policy, how even to elect public officials. And I became a very popular faculty. People enjoyed learning from it because it's something that is relevant, not theoretical. It's something that they see. Until now, it has not been an accepted concept in the academe. So what I did was get out of the academe and practice it, push it for key policies outside of the constrained world of the academic world. And that is what we have done in Strat-based ADR Institute. Just to mention, the World Health Organization and other international organizations rely on coalition building as an effective way to champion policy changes, thus achieving recommended targets to eliminate cervical cancer by 2030. The whole of society, not the whole of government, not whole of nation, but whole of society. Again, to reiterate what I've mentioned in our previous town hall discussions, continued support and advocacy from different stakeholders is needed to sustain responsive health services in the Philippines. We must all work together to make universal health care a reality for everyone, and thereby no one will be left behind. Today, this morning, as I welcome you, as I thank you for your participation, we are committing in Stratways to continue to be there with you as you advocate for strong initiatives in the healthcare space. Thank you very much, and I look forward to this fruitful discussion in this event.
All right, thank you very much for that inspiring message, Sir Dindo Manhit. It's always good to hear about the victories we've had against cancer in the past few years. But definitely, we still have a lot that we need to do. So that said, let's start our discussion with our keynote speaker, who will talk about the importance of stakeholders' advocacies in the elimination of cervical cancer in the Philippines. Our keynote speaker for today is Dr. Efren Domingo. He is an obstetrician and gynecologist and the current president of the Philippine Obstetrical and Gynecological Society. His top areas of care are pregnancy care, surgical procedures, women's sexual and reproductive health. Ladies and gentlemen, Dr. Efren Domingo. Let's give him a big round of applause.
Thank you and good morning. I am Efren Domingo. I am presently the president of the Philippine Obstetrical and Gynecological Society. But as I speak today to you this morning, I speak as a student in the 1980s and also as a young consultant in the 1990s and subsequently becoming a follower of the movement towards the elimination of this dreaded cancer, which is cervical cancer. And today I am fortunate to speak to you about this movement in our country. Next slide. We are very much aware that in Asia, this is still the leading cause of cancer in the reproductive tract and the leading cause of death in women worldwide. Next. In the Philippines, it is the second leading cause of female cancer and the third leading cause of female cancer death. In the Philippine General Hospital where I worked, we met the youngest case. She was a 13-year-old with stage 3 cervix cancer, and she came to us in uremia. And she became a commercial sex worker at the age of 6. Very sad, a personal social history. Next slide. So, the World Health Organization, as mentioned a while ago, the vision is to have a world without cervical cancer. And because of this, they initiated studies from 2020 that determined the incidences in 185 countries, and the target is to achieve a threshold of 4 out of 100,000 women years in many parts of Asia and Latin America. Next slide. This was shown a while ago. This is a very challenging target, the 90-70-90 profile that we have to achieve in screening, vaccination, and treatment. While we present this repeatedly, we are, of course, saddled by multiple factors, as well as collaborative challenges, as we spoke about it a while ago. Next slide. And so the global eradication is aimed at achieving this over a period of almost 100 years, where hopefully by that time, the incidences will improve and the deaths will be lowered. Next slide. And of course, there came to us that knowledge from the SAGE about the one-dose vaccination strategy. Careful as we are to adopt it, we have to read through them. And next slide will show that in that efficacious profile, 1 or 2 doses for the young, as well as the more than 21-year-old woman may be applicable. And for those immunocompromised and with HIV, where feasible, still 3 doses, or if not, 2 doses. Next slide. And so we have to deal with all the sectors in order to achieve our goal, and this includes government. And as mentioned, the Philippine Cancer Control Program, next slide, shown here, is a strategy to deal with the primary, secondary, and tertiary level of care in order to control this dreaded disease. At the pre-malignant aspect, it should be ideally diagnosed and treated in order for us to avoid having this disease affect the elderly 40 to 60-year-old age range. Next slide. So these are the 6 pillars. We have met this for several years already, from epidemiology, education, cancer prevention and early detection, treatment and training, tumor registries, and of course, pain and palliative care. It's a very comprehensive inclusion of all the concerns of an oncologist, but it actually begins right there in the primary care and public health concerns of clinicians. Next slide. So the objectives, apart from awareness, education, will be to screen and detect the lesions and treat it right there, hoping that the woman is good when she leaves the clinic, and then a very good referral system. And treatment protocols that are encouraged to be well aware in the scope of the generalists as well as the specialists. So as we speak, the objectives are indeed very challenging because it will involve a lot of the sectors in our community. It should actually be the most important concern this morning. We cannot do it alone as oncologists. We have to collaborate with government, with the public health sector, the community experts, as well as even the pain and rehabilitation specialists. Next slide. So look at cervical cancer control program. We went into providing opportunities for early detection and the declaration of May as the Cervical Cancer Control Month during the regime of President Arroyo, as well as of course, 2005, we started the cervical cancer screening program. And my next slide deals with that. And the next slide will appropriately be discussed as well this morning. And this was an initiative of our Department of Health with a target of having a VIA screening of at least once every 5 to 7 years. So the challenge indeed is to increase the frequency of women being seen in the gynecologic care of a clinician. If only that can be achieved, then it might really create a dent in the stage distribution of this cancer. Next slide. Next slide. So these are the options, but for the third world, Asia, Latin America, at least where available, a pap smear, or if not, a visual inspection with acetic acid, and detection of the lesion and appropriate treatment. Next slide. Of course, we have the different prescribed frequency of performance of cytology or VIA or the HPV DNA testing as prescribed by the different specialty societies here and abroad. But the common effort is to at least do a VIA or where available a cytology every 3 years or a HPV DNA testing every 3 or 5 years. Next slide. So the utility of the cervical cancer screening program, unfortunately, is low still in this country. And there is a need to increase budget as well as to convince government to put in more personnel as well as instrumentations necessary to achieve the goal. The profiling mentioned here is indeed a very difficult achievement which we all together should be able to hurdle. Next slide. So the proportion of women undergoing pap smear, those who had screening or have heard about screening is really very low. And the proportion of urban and rural patients undergoing the care of a clinician or education is still lacking in our very own country. Next slide. So the utilization of cervical cancer screening becomes a challenge because of these 6 concerns. Specifically because our women are afraid, they are financially handicapped, they are not well educated, they fear about the disease, and they are not ready for out-of-pocket service and vaccination or screening. Next slide. And so we have to step forward for cervical cancer screening. And a while ago it was mentioned, the NICA, and of course the stress was given regarding partnership and collaborative efforts from all the sectors available in this aspect. Next slide. So this was the proclamation of President Arroyo in her time, and it is indeed important because it will create a very good month per year to emphasize the care of women who needs effort on this control. Next slide. And so this morning also success with GPIGO will be highlighted. Next slide. We were fortunate in the PGH to be part of the objectives of the project. And next slide. We participated together with 29 other centers, and we were lucky to have contributed, next slide, the patients, next slide, in these numbers, and hoping that we will be able to arrive at a better profiling of our women with this cancer detected by HPV DNA testing, performing this and teaching the patients to do it on themselves, hoping that it will generate the ease of diagnosis and identification of the woman who is high risk, and with the possibility of a lesion and administering the treatment right there or in the next immediate follow-up. Next slide. So I like to summarize some of the results as I end my short address this morning. The WHO 2020 analysis of 185 countries showed that in the case of Asia, as well as in Latin America, the age incidence is becoming uncontrolled and they may peak at a later age, whereas in first world countries, they peak at a 30 to 40-year-old age range. It's because of the good screening and appropriate treatment of pre-malignant lesions. Next slide. And the analysis is driven by a very good screening and HPV vaccination. But of course, we will lose more women if we delay. Children will be uncared for because their mothers die. And this is very necessary to control early because it is a disease of the reproductive age group. And that is the exact message of the WHO analysis in their 185 countries analyzed. Next slide. So in the low as well as in low middle income countries, the next slide, please. It is important to introduce vaccination early, and the target should really be to include it in the community as well as in the school venues. The barriers for cervical cancer elimination are the discrepancies in the different screening, diagnosis, and treatment availability per country, per region, or for that matter, in the urban or local healthcare setting. So public health profiling of this specific area should be in detail and available to the clinicians so that they will be able to target the specific locality with high incidences. These are discrepancies of screening, diagnosis, and treatment. And of course, this will not be achievable without appropriate funding. And the next slide. I like to speak also that the level of human development, the HDI, the index of care as well as the availability of resources is the complete image of the difficulty that we have to hurdle in order for us to achieve the control of cervical cancer. It has been realized in the study of the WHO that if the HDI is high, the level of control of this disease will improve. And if we can only include the funding from all available government and non-government agencies, this becomes easily achievable. As I close, next slide, this short talk this morning, I like to share with you that from my end as a gynecologic oncologist, I actually lost my very own mother from cervical cancer. I recall bringing her to, it was still called North General Hospital for radiation, and at Medical Center Manila for radiation. She survived stage 3 cancer and lived 32 years, only for me to become a gynecologic oncologist. I eventually discovered as an oncologist a cancer again from the cervix, from the same virus when I was already a consultant. We initiated our best treatment for her, but because of many other factors, when it recurred 32 years later at age 81, she was 49 when she had it, when I was in grade 6. We were not any more successful. But we thank our good Lord that she was able to earn for me to become a doctor and a gynecologic oncologist and speak to you this morning at my stage where I said that I speak as a student, as a consultant, and as a son of a mother who was diagnosed and died from cervical cancer. Magandang umaga po, mabuhay tayong lahat.
Okay, thank you very much, Dr. Efren Domingo, for that very insightful speech. Definitely, as he said, and as Sir Dindo also said today, we cannot do this alone. We need the collaboration among the government, health experts, the public health sector, and also civil society organizations. So speaking of government, our next speaker will talk about the current programs of the Department of Health in curbing the cervical cancer cases in the country. She is Dr. Jan Ora Laurel Llevado. She is the head of the Specialty Care Division that handles cancer, mental health, and substance abuse at the Department of Health's Disease Prevention and Control Bureau. She is also the head of the Secretariat of the National Integrated Cancer Control Council. So ladies and gentlemen, let us all welcome Dr. Jan Ora Laurel Llevado.
You. So thank you everybody. I'm really not used in speaking in this kind of crowd. I'm used in just staying in my office, but my bosses tell me that I should go get out. So in the past weeks, I have seen legislators every day. I have been in the House of Representatives and yesterday in the Senate, and later this afternoon I will be meeting a congressman for a session on cancer. So, hello to everybody. So, before I start, let me just say thank you, of course, to Strat ADR, Professor Dindo, JPIGO, Dr. Ingrid Magnata, Cancer Coalition of the Philippines. I can see Ma'am Menchi here. Ma'am Menchi is part of the National Integrated Cancer Control Council. Of course, UHC Watch, POGS, Dr. Efren, and PIDSP, Dr. Fatima. So, Dr. Cora Ngilangel is also here. Magmamanong lang po. Good morning, ma'am. She's also one of our experts of the National Integrated Cancer Control Council, and we really thank the council for really guiding the Department of Health in terms of, these things about the cancer continuum. I myself is not an oncologist. I am a general practitioner, not even a general practitioner. I'm not practicing, so I am a public health practitioner. I was a previous municipal health officer in a far-flung island municipality in the province of Samar. So to begin with, let me start you have seen the slides, actually. So this is just a reiteration of what the department has been doing for the past years and what will we do in the next years. So next, please. So just an overview, these are really the objectives of the National Integrated Cancer Control Act. This is quite, heavy toll on us, especially in the government, to achieve all of these objectives. But I'm glad that this is really, a whole of society approach that we are doing. Next, please. So next, please. So this is just an overview of the NICA milestone. So as you can see, it is really per chapter. So this is a slide that we, give to legislators. So for cervical cancer, we have really focused, not just for cervical cancer, but for the other cancers. For the past years, we have really focused on cancer treatment and management. So as what Professor Dindo have shown you earlier this morning, the budget of the cancer control program has been really focused on cancer treatment and care. The Cancer Assistance Fund is focused on the diagnostics, treatment procedures, and some of the medicines. And the Medicines Access Program, which we have, I think, 1 billion for 2023. It's really just dedicated for the medicines. Next slide, please. So this has already been discussed. We know that cervical cancer is really one of the top burden cancers in the country. Um, Cervical cancer per 100,000 women is still at 14.5, and we know that to eliminate cancer, we have to maintain 4 per 100,000 women. Next, please. So as the 90-70-90 is really our guiding strategy for cervical cancer. So mabigat din po ito para sa amin. In fact, we actually can't monitor the 70%. We can only monitor the 90% here. So that's the reality. So I think with the help of Dr. Anthony and Japaigo, we can build an evaluation framework for this, and this would also anchor to our monitoring and evaluation framework for the new National Integrated Cancer Control Strategic Plan. Next slide, please. So just to show you what we have done with the human papillomavirus vaccination since 2015. So we started in 2015 with just a small cohort of 9 to 14 years old. So as you can see, among the years, mataas po nung 2015, 68%, but it's still low for human papillomavirus vaccination. The target is really 90%. Generally, for the EPI, our target for vaccination is at 95%. As you can see, going to 2022, we have really stumbled with our vaccination rates. Japaigo is helping us with the Happy Project to have a really, comprehensive landscape situational analysis to understand what has really happened across the years. So one of the really important, explanation, the COVID, we have COVIDized. Lahat ng bagay is because of COVID, right? So as you can see in 2021, 2022, 0.34% and 3% for 2022. So really that's quite sad. But in reality, HPV vaccine is really expensive, right? So from the Department of Health perspective, we really have to prioritize. So as you know, we have our expanded program on immunization, which covers other routine vaccination. For 2023, we have procured 1 million doses of HPV vaccine, and that's still not enough for the 9-year-old cohort, right? So as WHO has recommended a 1-dose HPV vaccine, we are actually pushing for that, and we have submitted to the Health Technology Assessment Council to approve HPV 1-dose vaccination. But I think there's also another conversation with the pharmaceutical companies about this. So we have started our staff work. We have write to certain pharma companies, and I think in the next months we will be meeting them through our pharmaceutical division to discuss further this thing. So this slide, this is really just to show you that for the past years, our vaccination has, we have been behind with the human papillomavirus vaccination. Next slide, please. So what are our ways forward for the vaccination? In the 7th National Integrated Cancer Control Council, we have discussed strategies for HPV vaccination. We have met with Gavi actually, and the Japaigo is helping us with the Happy Project. So one of the critical important points for this is to really test a service delivery model for human papillomavirus vaccination. Before, we have done school-based vaccination, then we shifted to community-based vaccination during the COVID-19 pandemic, but there are still a lot of problems. It seems that community-based vaccination does not work compared to school-based vaccination, but we're not saying that one is over the other. So I think we really have to test the service delivery models for this. We also have to integrate vaccination services in other public health programs. So I was a previous family planning program manager. So sabi ko nga, once the mother gets family planning services, offer her child, if she has a 9-year-old, girl, for human papillomavirus vaccine. So it's really a, mother-daughter strategy when they go visit to the health center. add more alternative access sites for vaccination. We have done this during COVID. We have engaged Watson's, Healthway, and all the other sectors. Of course, continuous evidence generation to guide us with, protocol and practice guidelines. Next slide, please. So this is a very important collaboration with us, really very important, because if you have reviewed our health service information system, our VIA is quite not really implemented in some health centers, probably because of several factors. For one, I haven't done my pap smear because I don't want to, be in lithotomy position and have a speculum inserted. So this is really good because this is self-collection, and I'm happy that Dr. Ingrid helped us with this. Of course, Dr. Cecilia Llave. But as you can see, screening for cervical cancer has really gone down. So again, it's still because of COVID. In 2020, from 224,000 screened, it went down to 40,000 women. For the Success Project, we have screened 25,000 plus women with 9% positivity. But the lessons really that have taught us with the Success Project is that it's not just important to, improve one part of the health systems, but it's really the entire health system, because we have seen problems with recall of patients. In fact, out of those 2,000 triaged patients, only, I think 63% were recalled, no, and were given treatment. So that is still quite low. So our target really is to treat all those women who were triaged. So patient navigation have taught us that it's really important it's really critical to have patient navigation, even with the Success Project, and to, even just follow up or a reminder message to go back to the Apex Hospital where they can get treatment. It also taught us to capacitate our lower level facilities. So what is the roles and responsibilities of our level 1 and level 2 hospitals? What is the responsibility of our level 3 Apex hospitals to these lower level facilities? So next slide, please. So this is just to show you our resource stratified framework for, really, this is for universal healthcare. So as you can see, we have the specialty care here. This is our Apex hospitals, where Dr. Llave and her team are doing the treatment and all. But the Apex hospitals really goes to the general care for outreach missions, right? And this is where patient navigation is important. This is where data is important. This is where multi-sectoral collaboration is important. Even transportation could be thought of. Even the, other logistics of the patient should also be thought of. So this is just to show you that these two care models are very important with the NICA and the universal health care. But specifically for us with the screening, I would say general care is more important. Because, treatment is mahal. Screening is more mura. But in reality, yung funds talaga namin is really dedicated to treatment. So, isa yun sa dapat namin talagang pag-isipan. And siguro if you guys will be advocating more budget for the Department of Health, tell the legislators that we really need budget for screening. In reality, hepatitis B screening, which we procured before, has already been devolved. So it's the responsibility of the local government units now. So what happened to hepatitis B screening in mothers? It went down, right? Because we were no longer procuring hepatitis B kits. Good thing that the HPV DNA kits happened after the devolution transition plan. So now we will be procuring for the HPV DNA kits once the HTAC has positive recommendations. Next slide, please. So what are the challenges for screening? Of course, number one, yung sinabi ko kanina, is budget. We really do not have budget for screening. That's the reality. we also have poor demand from target population. So I think communication plan is important. Even with the success project, communication has been, one of the critical things that the JPIGO team has been doing. Sustainability concerns for new screening modalities. So what we have to do is really to need to intensify service delivery and forge partnerships. So not just for the government, but really still for the private sector and even for the local government units. Strengthen reliable reporting mechanisms and need to work on generating evidence. So bakit important sa amin yung evidence? Kasi may evidence generation and management division na po kami. So if some of the sectors have new interventions, if before we just accept all these interventions and implement now, these interventions are appraised and reviewed by the evidence generation and management division. And their team is really developing the clinical practice guidelines with our medical societies and our hospitals. Next slide, please. So treatment and management is also important. So we know that for sustaining financing in healthcare, PhilHealth benefit packages is important. So, but ilan lang ba ang nasa Z benefit package natin? Cervical cancer is still low. Breast cancer is only at 100,000. Ilan lang hospitals ang accredited for Z benefit package. So kaya, we still provide assistance through the Medicines Access Program and the Cancer Assistance Fund. Of course, we have the Malasakit Program and the Medical Assistance Indigent Program, but it is really for, indigent population. So the good thing for the Cancer Assistance Fund and the Medicines Access Program is that it does not define your social class. Kasi sabi namin, pag pumipila, nangangailangan. So, kinakailangan bigyan. So, for the Cancer Assistance Fund, one of the gaps that we are really, paano bang quarreling ba with the Department of Budget and Management, is we are pushing really with the Department of Budget and Management is to include high-risk population. Kasi sa Cancer Assistance Fund, ang dapat lang namin daw i-cater is yung diagnosed cancer patients na, because yun ang sabi ng law and yun ang sabi ng General Appropriations Act. But now we are working on including high-risk groups, including budget for prevention and detection, and that we will no longer be developing policy every year because the Department of Budget and Management requires it from us. So, kung dati ang DOH tumatanggap lang kung anong ibigay ng Department of Budget and Management, I think we have shifted from that paradigm that we really have to fight for what is really dapat na budget for us. So now we are hoping that the Cancer Assistance Fund policy, new policy, will be approved to include high-risk population in the Cancer Assistance Fund. So what are our ways forward? So of course, anchor treatment protocol on the latest cost-effective evidences. Perhaps in the future, we can eventually expand access sites. So before we have 31, for this year we have 35. We have included Amaypakpak and BARM, Amaypakpak Medical Center, because they do not have an Apex hospital there. So for those of you who are going to BARM, Amaypakpak is already part of the access sites. We need to review treatment medicines access program. So in the next months, we will be reviewing our medicines in our portfolio. We will be setting criteria on kailan ba tayo magdadagdag ng medicine, kailan tayo magtatanggal, anong criteria to include, when do we include newly approved medicines in the Philippine National Formulary, and what do we do with the innovative medicines. Then, of course, expand the Cancer Assistance Fund, as what I have said earlier, and enhance and expand existing PhilHealth benefit packages. Next slide, please. So, what is really our model of care, So, in the Universal Health Law, ang principle talaga natin is primary health. But in reality, ganito pa tayo, Apex Hospital is still at the top. We are still, I think even us, hindi tayo pupunta sa ospital pag hindi tayo malala. But, next slide please. But I think we really have to shift our perspective to, having primary care as an important, critical and important step kasi it's first contact. So, dapat nasa taas na yung mga barangay health stations. Dapat screening is already with the barangay health station. So, HPV DNA intervention is really good kasi pwedeng gawin anywhere as long as you are connected to a treatment facility. Next slide, please. I think one of the things that us government should also think about, where do investments go? So as I have said earlier, we are really focused on treatment and management. In fact, we have budget for that, but in reality, wala tayong budget for screening. Even for training on screening, we don't have budget for it. Why? Because we have already been given budget for treatment. So I think that's one of the things that we should really communicate with our legislators, that if you give us budget for the entire continuum of care. Right? Next slide, please. So I think this is my last slide. So naka-red yung enable to be healthy, because this is really our way to go, primary care, to have, healthy workplace, healthy settings, and healthy communities for healthier Filipinos. Thank you and good morning.
All right, thank you very much, Doc Jan. Growing up, we were always told that an ounce of prevention is worth more than a pound of cure, right? I think we have to remind our legislators that when they attend to our budget. I think they're working on their budget right now. So, yes. But before we proceed to our next speaker, I'm sure many of you have some questions that you want to address to our speakers right now. Just a reminder to our guests here in the venue, if you look at your tables, you have papers on your table. You can write your questions there and hand them over to our organizers. Some of them are at the back. And then we'll try to address them or answer some of your questions later during the open forum. Now, for our Zoom participants, should you have questions that you want to ask to our speakers today, please feel free to send your questions to in the Q&A box in the lower part of your screen. We'll also try our best to answer them later in the open forum. All right, our next speaker will be talking about scaling the cervical cancer elimination efforts in the Philippines. She is Dr. Ingrid Magnata, the current country program manager for JPIGO Philippines and the strategies lead of the scaling up cervical cancer elimination through secondary strategies, or the Success Project in the Philippines. Again, ladies and gentlemen, let us give a warm welcome to Dr. Ingrid Magnata.
Thank you. Good morning, everyone. May I have my slide, please? So I'll be sharing with you our story on how are we supporting this country towards scaling up cervical cancer elimination in the Philippines. Next slide, please. So first, JPIGO, we are an international nonprofit, non-government organization that's affiliated with Johns Hopkins University, wherein we are in around 30 countries in Africa, Asia, and Central America, and we have at the global level 4,000 staff. And these are our expertise. Next slide, please. So as we support the country towards accelerating cervical cancer elimination global strategy, we are guided by this, and we have discussed this earlier. But I just would like to highlight that these targets, as mentioned, that the 90-70-90 targets that must be met by 2030 for countries to be on the path towards cervical cancer elimination. So when we are in this stage wherein we have the 90-70-90, we are just in that path toward cervical cancer elimination. And we would like to highlight that yes, this is a long shot for all countries, just like the Philippines, but we have to start it now. As presented earlier, that we have a long way to go is in terms of vaccination, in terms of women who are screened with high-performance test. The challenge, as mentioned earlier, that we don't have a good data in terms of that 70% as well as the 90%. If this country wants to move toward cervical cancer elimination, we have to have a good data. That's why I'm really emphasizing that if you want, as we gather this in this room as a movement, we really have to think, organize ourselves, be systematic on how are we going to move forward this vision or our dream to have cervical cancer eliminated in the Philippines. Next slide, please. So our guiding principle, just like what the Department of Health presented, and just like what Professor Manhit presented, that we should look into this as a life course and public health approach. Public health in the sense that we're talking of the population coverage here. We're not just talking of the individual, but rather let's talk of how many women do we need to reach. We're talking of 6 million women, 30 to 49 years old. And we have to consider social justice and equity. And who are the vulnerable women that we need to reach? And this should be integrated, people-centered health approach. So we're talking of what's the current healthcare services in the country. So how can we integrate all these initiatives in terms of HPV screening? We don't need to really start from just saying that, okay, we do HPV screening, but rather we have a lot of existing healthcare services, the reproductive healthcare services, wherein we can do the HPV DNA screening. So if you look at the 3 boxes here, they're saying that the WHO says that this is not new. We have all this. We have all this in the Philippines, so this is not a rocket science. We have HPV vaccination, and we have screening and treatment of precancerous lesions. And we have treatment for invasive cancers and palliative care, as emphasized earlier by Dr. Jan. But we have to see all these accelerators inside these boxes. Sufficient, affordable, and supply of HPV vaccine, introduction of HPV vaccine, and increased quality and coverage of service delivery. And the second box says that sufficient and affordable supply of technology and products. What is it that we have in the country? National scale-up of screen and treat. For us as a project, we're just looking at 40,000 women to be screened under the project, success project. It's 40,000. But if we look at the country's need, we're looking at 6 million women. Kunti lang yan, di ba? That's 40,000. And then, so really need for us to scale up. And then increase quality and coverage of service delivery. That's why as Japaigo, we are really into quality in terms of service provision. So later I'll show how Dr. Liave here and then Dr. Lorraine and together with POGS really come up with this clinical skills training to ensure quality in terms of service provision. And then we have below these yellow boxes are aside from having those 3 boxes there, 3 direct strategies. These are somehow the support mechanisms that sometimes are indeed challenging. We have the awareness, demand generation, data management, the financing, policy advocacy, innovation, and research. So we have subjected cervical cancer elimination strategy into complex adaptive systems thinking. And lo and behold, really, we find that it's not really that easy as it seems to do for us to have cervical cancer eliminated in the country. But we can do it, but it's doable. Next slide, please. So this project that we're having, this is funded by UNITAID. This is just one of the projects that we're having towards supporting this country on cervical cancer elimination. And at the country level, we are in partnership with Cancer Coalition. This is through the Union for International Cancer Control. And when we started this project, we have introduced this, and we are supported with the technical support group from the National Cancer Institute of Brazil, USA, Japan, and France. And of course, we have with us the guidance of the WHO. And at the global level, the success project is led by Expertise France. Next slide, please. So when we came in the country, carrying with us the success project, this is being conducted as well in 3 other countries, in Guatemala, Cote d'Ivoire, and Burkina Faso. We directly coordinated first with the Department of Health. And then we heard the commitment of the Department of Health to move towards this cervical cancer elimination because as a country, we are signatory to the World Health Assembly on eliminating cervical cancer. So the MOA with the Department of Health was signed in 2021. This was in the midst of COVID-19 lockdown. And we are happy that together with the Department of Health, we were able to start up the implementation of the project with all these issuances by the Department of Health, the imprimatur of the Department of Health, to proceed with introducing the scale-up secondary prevention strategies. Next slide, please. And the game changer for this project that we would like to share in the country is mentioned earlier, that the introduction of HPV DNA testing through self-collection as secondary prevention strategy for cervical cancer. Next slide. And these are our photos just to show how are we approaching, how are we strategizing to really reach those women. For us to, we're not after the target for this project, but for us to demonstrate the feasibility, the acceptability of doing the self-collection. And lo and behold, you know, of the 25,000 that we have screened, almost 95% of women, they are agreeable to do the self-collection, you know, for their subject themselves for cervical cancer screening using the self-collection kits. Next slide, please. And before as we have mentioned, that we have to connect the screening that we are doing to treatment, we have to ensure that all our facilities whom we have identified 30 sites in the country just to in place the system and demonstrate the system, come up with the proof of concept that this is doable in the country. So we have trained service providers in terms of how to use thermal ablation, because we don't have the thermal ablation yet in the country, but we have introduced that in our countries. But what we are using now, we have the cryotherapy and the LEAP. In addition to that, we have brought in the country the thermal ablation. And the thermal ablation, later if you'll ask Dr. Liave and Dr. Efren what you call this very portable machine that even the midwife can perform, can use this machine towards treating those precancerous lesions, no, that we have for those women found positive for HPV. Next slide, please. And of the screened women, around the 25,000 screened women for cervical cancer using HPV DNA, 95% of them opted for self-collection. And as a strategy, we've been doing outreach activities across the country in partnership with the 30 sites that we have identified together with the Department of Health. And we have trained community health educators on basic information about cervical cancer. So it is very strategic for us to see that based on what we were doing, these are the key lessons learned. Urban poor and working women are valuable and critical partners in promoting benefits, increasing uptake, and improving acceptability of cervical cancer prevention among women living in low-resource and hard-to-reach settings. Community-level delivery of services makes for easy communication of preventing cervical cancer as within reach and doable aspiration. That's why I like Dr. Jan's presentation earlier. The model of care that we need to have now in the country. We need to look at that, start with the village level. No? So because really, when we talk of cervical cancer, that's a very good model that we need to now demonstrate to our, especially to our legislators now. No. If the budget, I'm connecting that with the budget that we're having, as mentioned, is more on the treatment, but prevention is a lot cheaper than treatment. So we have to emphasize that one to our legislators as a movement, for all those people gathered here. I'm just saying that let's not be caught up with the hype of this month of May celebration. But rather, let's look at this as a continuing approach that or actions that we need to do. And scale-up considerations, mainstreaming of community health education training in primary healthcare workforce, training HIV providers, and advocacy groups in cervical cancer prevention basics, and then institutionalization of community outreach initiatives. And as mentioned earlier, I don't know if we have presented that for those women living with HIV, it's very critical for us to reach this group because 35% of them really would lead to, they're prone to progress towards cervical cancer than the general population. Next slide, please. So, as a organization, so what are we doing in terms of looking at how would we really operationalize the cervical cancer elimination strategies? No. We are, as an organization, we are a pharmaceutical agnostics. No? So we would just like to show to the government, to the Department of Health, to the private sector that there are different modalities that we can do when we talk of HPV screening. So for now, in the Philippines, we are demonstrating the use of the decentralized model or the near point of care. So this is the model we are using in the Success Project. We have maximized the presence of the Gene Expert machine in the country, and then the Department of Health through the Global Fund projects, they allowed the use of the Gene Expert machines for the HPV DNA to be integrated in the use of the Gene Expert machine, aside from the TB and HIV testing that the machine is doing now. And now we are demonstrating the centralized laboratory model for HPV using the high-capacity platform. So this is one way to show up our public-private partnership, wherein we are utilizing the COBA system. So we are in partnership with Roche and High Precision Laboratory, wherein this one is being modeled or piloted in 5 local government units in Metro Manila, and then in partnership with DOH hospitals as treatment sites. So we are looking at, again, modeling the screening of around 5,000 women in 5 local government units using the centralized lab model approach. And we hope that this will be seen as an opportunity for us, no, to widen our reach, no, in terms of cervical cancer screening in the country. Next slide, please. And just to show, Dr. Jan showed this earlier, that as of May, this is the latest, I got this report early this morning, we have a number of women screened, 25,878 women who tested positive as presented, it's 95%. And for women living with HIV, we're looking at 96. You know what? We're looking for 600. Initially, we're looking of like 2,000 to 3,000 plus women living with HIV, but we're only getting few numbers of women living with HIV for them to be screened. So we are partnering with the HIV/AIDS group in the country now. And the challenge that we are seeing now is women who were found positive. For example, from the general population, the 2,380, only around 35% of them would come back for assessment, further assessment. So that's the challenge that we are facing, and we are responding to this challenge in partnership with our OBGYN societies as well as with our 30 project sites. And we hope that our aim is to reach the 90% of 90% of those women found positive to be coming for assessment. But for those women who came in for assessment, the treatment rate is high. It's like 95%. Okay, next slide, please. And one good thing that we would like to share with you as an organization, we're able to get partnership with Bill and Melinda Gates Foundation. And this was mentioned earlier by Dr. John, that we have this HPV Vaccination Acceleration Program Partners Initiative, and we have our technical advisor around, Dr. Anthony Calibo, who's doing a lot of work on landscape analysis as to where we are in terms of HPV vaccination. So as an organization, we are the one working at the country level. Next slide, please. And the objective of this project is to plan for the objective is to accelerate HPV vaccine access coverage, sustain equity program, restore and maintain HPV vaccination. And we are closely working with the Department of Health on this. Next slide, please. And why are we having this movement now? My heart is actually really full. And after that talk during the National Cancer Summit sometime in March, when Mr. Orly approached me after my talk in that summit, that, hi, Dr. Ingrid, can we talk and then talk about the zero cancer, cervical cancer, the project that we have in the country, and perhaps we can come up with a manifesto. And then one Saturday we met together with Dr. Yabe and the rest of the societies, OBGYN societies. So said, why don't we come up with a movement? Why don't we come up with a movement? And lo and behold, we are here now launching this movement. So thank you very much, Stratbase, for that initiative. And then, why are we talking, why are we in here? Because 20 new cervical cancer cases, they are diagnosed every day. So just like as we're standing here now, 20 new cervical cancer cases are being diagnosed. And then today, 10 women die due to cervical cancer. And tomorrow, that would be 20. And then there will be an additional 40 cases. So, and we all know that cervical cancer is caused by a virus. And that virus affecting our body can be prevented, just like what we have done with that COVID-19 virus. So the cervical cancer is preventable. That's the message that we want to tell, not just to this group, but to the Filipino people. And then this is treatable and can be eliminated. Next slide, please. This is a call to action. We need to work on the awareness and demand generation in the country. We need to look at the health technology assessment, because we really would like, as a Filipino, I want that all coming in the country, whatever technology it is, should be with quality, right? And sustainable financing, what can we do about it? We have PhilHealth, so let's discuss this with PhilHealth. And then let's look at the laboratory network mapping. If we have a huge network for laboratory diagnostics, perhaps we can reduce the cost of HPV DNA screening. and then public-private partnership. And as I've said, we need to organize ourselves, be systematic, and then, of course, looking at the quality in terms of screening and treatment for the service delivery that we are doing. And highly emphasizing data digitalization and always innovation and research. So whatever organizations you are in now, as a movement here, or perhaps there will be a lot of members in that movement, the movement that we are having, launching now, perhaps we can approach whoever's the members of the movement to just identify where can we contribute, in terms of moving towards cervical cancer elimination, in the Philippines. Next slide. So achieving a nation free of cervical cancer, yes, it's doable. And we are happy, and I am very happy that we have this Philippine cervical cancer elimination movement. But we need to organize ourselves, we need to systematize all our efforts, and for us to reach the elimination level, we have to scale up. And most especially, we need to empathize. Next slide, please. And with that, thank you very much.
Okay. Thank you very much for that very insightful and very important presentation, Dr. Ingrid Magnata. Okay. Our next speaker is supposed to be Miss Carmen Auste, but unfortunately, we got a message from her early this morning that she won't be able to make it due to a medical emergency. So we'll be proceeding to our last speaker for today, who will talk about the World Health Organization's global strategy to accelerate the elimination of cervical cancer. Our next speaker, or our last speaker, is Dr. Rui Paulo de Jesus. He is currently the World Health Organization representative to the Philippines. Prior to his appointment, he was the WHO representative to Bhutan from 2017 to 2023. He also worked at the WHO Southeast Asia Regional Office in New Delhi, India, as the coordinator for country support and coordination from 2015 until 2017. Unfortunately, Dr. De Jesus will not be able to join us live today, but he did send us a recorded message. So let's listen in to Dr. De Jesus. Okay, I think we're having we're just having a technical difficulty. We tested this earlier, it was working. So let's try again. Okay, hello? Let's try again. Okay. All right. Okay, so while they are attending to that, or are we ready to try again? Okay, so maybe while we're waiting for them to attend to the technical difficulty that we are experiencing, we can proceed to hear the reactions from our stakeholders, okay? So our first reactor is Dr. Fatima Jimenez. She is the president of the Pediatric Infectious Disease Society of the Philippines and the chair of the Committee on Immunization for the Philippine Pediatric Society. She is also the chairperson of the Antimicrobial Stewardship Program. Efforts in the country. We were supposed to have Miss Karen Villanueva of the Philippine Alliance of Patient Organizations, or PAPO, but we were just told also that she will no longer be able to make it. She is still on her way back to the country from another, I think, appointment abroad. Okay? So are we ready to try again the message from the WHO? Okay, we're yeah. Okay, I don't think we can hear. Okay, so we're also still waiting for Doc Timmy. Oh, here. Doc Timmy's already here. Hi, ma'am. We're currently experiencing a technical difficulty with a video of Doc Rui, so we'll have to proceed with your reaction, ma'am. Okay, again, let us welcome Dr. Fatima Jimenez to give her reaction on the presentations done earlier.
Thank you, Joyce. And I'm so sorry about that. I thought I had time to go to the ladies, and I did go to the ladies for, to answer. And I'm so sorry that was too much information. But good morning. I'd like to introduce myself. I'm Fatima Jimenez. I'm the current president of the Pediatric Infectious Disease Society of the Philippines, and fortunate enough to be the chair of the Immunization Committee of the Philippine Pediatric Society. So I'm wearing two hats, but I'm going to wear a third one as a citizen. Okay, trying to do my bit, our bit as a society to contribute to the reason and to the advocacy. This is the reason why we're here, to work towards something that is achievable. It may be impossible listening to all the cracks and the challenges, but let me start off because I know I only have 5 minutes. So, Professor Dindo, I wish I was part of your class in De La Salle, but I didn't get to go to De La Salle. But thank you to Strat-based. Ambassador Del Rosario is a patriot and such an inspiration, and it's a privilege to be here with you. Dr. Domingo, thank you very much. I feel that in anything, if you only get to feel, if you experience it, I think that's one. It becomes a reality when what you're talking about, or a sad reality, becomes a personal experience. And my father died from colon cancer, and I have partnered on social base, on an individual initiative with some of my pediatric oncologist friends in giving a little bit of joy to the cancer children. I'm with Philippine Children's Medical Center as well. So Dr. Domingo, you did speak about a 13-year-old with cervical cancer. And I'd just like to share a bit of what we have done in the Philippine Pediatric Society, knowing that vaccine hesitancy is part of what we're facing now, not just for cervical cancer, but for other vaccine-preventable diseases. And when you said that this child was forced into being a commercial sex worker at 6, this makes my heart bleed, because in the last pediatric convention, Dr. Madrid, of course, you know Dr. Bernadette Madrid, a Ramon Magsaysay awardee who champions children's rights. Okay, there were a lot of things that were brought into view in one conference. There were two things that the Philippines, we are an easy target for abuse. Because one, these are two things which should be working for us. One is the ability to speak English. The second one is having an efficient money transfer. Those are two things that make us targets for exploitation, and that's really a sad thing. So looking at the population we're targeting, which is 25 to 55, I think we have to bring it down because we have our statistics. So Dr. Jan and Dr. Ingrid, thank you very much. You bring hope, giving us those strategies and those projects. And I'd just like to share a little bit of the knowledge, attitudes, and practices survey that we did from a grant from the American Academy of Pediatrics and PPS, wherein we are trying to see if motivational interviewing can address vaccine hesitancy, because vaccine hesitancy is really very convoluted. No? It used to be such a straight-laced definition, but it's very multifactorial. Because vaccine hesitancy, you speak about that's either a delay or a refusal in the face of having the logistics in place, plus a lot of other things. So when we did that survey, which involved 1,200 plus pediatricians, practicing pediatricians, private pediatricians, one of the things that hinders uptake of vaccine services is cost. Cost for those vaccines that are not in the EPI. What were the other things that we found out? Aside from cost, were concerns on safety issues. A third one, I haven't ranked it, but these were the ones that were found out in the survey, was misinformation. Misinformation. If you're speaking about cervical cancer, okay, people don't think, and they always say, no, it's not for the younger age group, right? It should be. There's still a lot of gray areas. And one of the things that hinders, aside from the cost, is the fear. The fear of the vaccine itself, safety, because of all these issues. And I think one of the things that we had to address for that motivational interviewing was also having that cancer vaccine, or that cervical cancer vaccine, was a license, okay, to encourage early sexual promiscuity. So those are some of the factors that I'd like to share with you. And having said that, I do have a tick list, because I am here because we as a society have to do our share in contributing to the cause. So one of the things that we have been doing for vaccine-preventable diseases is an information campaign. And we have partnered with DOH and local government units, because we know that vaccination has been politicized. Let's just make it, I will have to be that blunt. So having said that, we were saying we've been advocating for the last couple of years, but it's always been preaching to the choir. We haven't really reached the grassroots, and you and I know that 90% of the population for the EPIs are in the grassroots level. For the NGOs like PPS and PIDSP, okay, the people that we cater to are only just about 5 to 10%, but we're trying to do our best. And we realized that at the grassroots, the level of acceptance and the level of understanding is pretty low. It's only up to a certain level. So having said that, knowing that you're trying to penetrate the community, that is also one of the things that we can do together. We can provide knowledge. Probably we're only around 158 or 156 as of the moment in PIDSP. In PPS, we're around 6,000. But I feel that with all these things and somebody giving us a clear-cut plan on what to do, we don't have to do it big. We can start small, but I think we need direction. That's one, what is it exactly that you want to do? And we could probably do bite-sized pieces, and together we can contribute, right, to solving something that might be impossible. But, okay, together I know we can, but 2030 is still 7 years away. So that now that we've started this movement together, we hope, we're not making promises, but we know what we can do as a society, because we've been doing this for the last couple of years that we've been in existence. So thank you very much. I think I took more than 5 minutes.
Thank you, ma'am. All right, thank you very much, Dr. Fatima Jimenez. Okay, are we going to try again the WHO message? Okay, we'll do that after the open forum. So at this point, we will now start our open forum. So we would like to invite our speakers in front. I think we'll be having some chairs here. Okay, ayan. We would like to invite our speakers again in front, Dr. Efren Domingo, Dr. Jan Ora Laurel Llevado, Dr. Ingrid Magnata, and Dr. Fatima Jimenez. Ma'am, you can may join us again, please. All right. And to our attendees here in the venue, again, should you have questions that you want to ask to our speakers, you have papers on your table, sheets of paper on your table. You can write your questions there and hand them over to our organizers, who will try to ask them during the open forum. 1, 2, 3, 4. Sir, 5, just 5 chairs. Yes, just 5 chairs. And then for those who are monitoring the event via Zoom or Facebook Live, you can send your questions to the in the Q&A box in the lower part of your screen. Okay. No, it's okay. 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 Thank you very much again to our speakers and reactor for a very insightful, interesting discussion this morning. Some of the questions I prepared have been answered during the presentation, particularly the challenges in achieving the 90-70-90 target. But before we start, maybe request for the projector to be turned off para hindi kasi may mga nakasulat sa Facebook. All right. So, okay. So as I was saying, one of the challenges, some of the challenges I was able to take note of is first definitely the budget in prevention, and also the lack of awareness and knowledge leading to the fear amongst women in getting screened, going to the doctors, ganyan. First question on the budget, how can we convince the government and lawmakers to prioritize prevention? Paano ba natin sila mako-convince po na this time, an ounce of prevention is worth more than a pound of cure? Doc Efren, would you like to answer?
I hear your comment on the budget, but the one that enters my mind outright is the ethics of allocation of limited resources. That's a very huge topic, which can be formulated in the form of a debate, and one will take a pro, the other will take a negative. But as we speak, that indeed is the greatest difficulty, because we are in a setting where people are dying from infectious diseases and other common illnesses that require even greater budget. But here we are presenting a disease that takes 5, 10, 15 years to become an invasive cancer. And that argument is the problem. They think that because of the protraction of the disease before it can kill, a local regional disease that can be controlled with radiation before it becomes metastatic, these things we have to be very good in defending outright when the debate happens with our budget experts, with our legislators. I fear that it will be difficult to convince, but as difficult as it is, I'm going to tell them that if you will allocate budget, it should be in the pre-invasive, in the primary, or in the pre-coital age. If only to create a dent, I believe that is the best argument when I take the pro stand in the debate. Thank you.
Dr. Zan and Dr. Ingrid?
It's actually very difficult to answer. Imagine us in the Cancer Control Division handling different cancers. So every medical society has its own agenda, and we have to prioritize, right? So I think it's also the same with the legislators. So, but to begin with, we really have to show them the data of what is it really telling us. So what is the for example, what will cervical cancer look like in 15 years time if we invest in prevention versus treatment versus something else? So I think that's one part of the Health Technology Assessment Council, that they really assess this cost effectiveness. I'm not an economist. I worked in the School of Economics before, but it's not, numbers are not for me. So I think that's one, should be evidence-based. Second is, I think the experience that we are actually portraying to the legislators is actually quite a bit different. Kasi sila, naramdaman nila that, for example, some of our legislators have, family members or relatives who have cancer. So parang ang pakaramdam nila, financially catastrophic talaga yung cancer. So that's why they're really bringing in more money to treatment and management. But we are quite a bit backward with the communication on the prevention part. So I think these are the things that we actually have to work on. So communication is very important. For us doctors, it's, I think, one of our skills to communicate more on a laymanized term. So ganun din sa legislators, to more laymanize the communication that we are actually doing. Thank you.
For Doc Ingrid and Doc Timmy, I would like to ask about the second challenge, the lack of knowledge, awareness, which leads to fear of getting screened and taking tests. How do you see the current acceptance of patients, given the sensitivity, to be regularly screened by their OB/GYN, and how else can we help disseminate information or awareness on cervical cancer in the communities,
I really would like to respond to the first question earlier. No, but because with regard to the budget, we need to look at it as, in addition to what they've said, and the whole of society approach, that we know that budget is always scarce, resources are always scarce, that we have to look at the public-private partnership in here, and then we need to look at the law of supply and demand. That's why we have with us, we want to talk with the government on how are we maximizing the limited resources that we have in terms of implementation, in terms of coverage, in terms of strategies. and then we'd like to reach out to perhaps to the pharmaceuticals. No, so given the demand that we're having now, so these are like the thinking that we can bring into the table as we talk about budget in the country. Now, going back to the second question on the awareness, indeed, based on our experience, there will be like 100 women who would be registering for HPV DNA screening in one community in Tondo, but only like 50% would come during the actual HPV DNA screening. So they know that the service is free, it's there already, but only 50% would come. So that means there are a lot of factors aside from perhaps, yes, fear, but again, really need to we need to like strategize how are we giving this the message in terms of cervical cancer. So as mentioned earlier, when we talk of cancer, people are just so afraid. If I'm diagnosed to have cancer, I don't have that money to go to the hospital for treatment. So as simple as I'm looking at COVID-19 experience. People were so afraid then of COVID, but when we told them that, okay, this can be prevented because we have vaccine that can really reduce the incidence of COVID-19, then lo and behold, we're now in this phase of COVID-19 endemicity in the country, but we are not in the pandemic stage anymore. And the screening, we hope that we can have that a strategy wherein anyone can do it on her own. As mentioned, that we don't want women to be like lying down in a lithotomy position. So we all know that. Tayo babae, ayaw ko rin. My pap smear just was like when I was 45 years old. So having that kind of game changer, that self-collection, is one of the key sort of innovation that we have in this century as far as cervical cancer elimination is concerned. That message, I think, is very important for us to relate to our women population in the country.
Okay, I think you've given all the replies I was going to say, but let me just add to the pile. I think one of the things that we can do as medical societies is to strengthen laymanizing, information about cervical cancer. That's one. That's a strength. I've been doing that through infographics and through guestings. We're trying to do our best keeping up with social media, but it's difficult. But it's something we can look at. I think it's not enough to have educational materials. And we have to assess the impact of these materials as well, because the key messages have to be unified and simple enough for the man or the woman on the street to understand. And these have to take, this has to be a priority, because let's face it, okay? We're just coming out from the pandemic. Life's pretty difficult, economic upheaval and all that. So the basic necessities are the ones that people will be trying to attend to. So this has to become something that's, I dislike to say instill fear about cervical cancer, because that's not the way to go, right? But sometimes it's the fear that drives people to action, just like COVID. Because there are also vaccine preventable diseases that are equally devastating, like measles, right? So it has to be at that level, and at a level where we need that they will understand. Next, our current, I'm sorry to the Department of Health, I hear your cry about the devolution, right? And one of the things that we're trying to do actually is to target our local government units, because they are the ones who can champion our cause. And that's what we've been trying to do, right? So it's not a shame. It's not a shame game that your coverage rates are low for this. But what we're trying to do now is look at, and I'm talking about not HPV because it's not part of the EPI, but we're trying to look at the particular areas wherein there needs, we need to intensify our efforts because we can't do it alone. So I really feel sometimes if it's the priority of the local government unit, they'll take you up on it, right? They'll take you up on it. So there is much work to be done, but since, the seeds have been planted, it's just a matter of pushing. And pushing towards, pushing and looking towards people who can champion the cause for us. Thank you.
Thank you, ma'am. So we have a bunch of questions from our audience. First question is, I think some of you already addressed this, but just in case you have additional answers, what should we do differently to accelerate our cervical cancer elimination efforts? Who else should we involve? I'm thinking top of mind, dapat ba nasa TikTok na rin ang cervical cancer awareness? Doc Jan, Doc Efren?
Actually, tama ka, ma'am. When we had our COVID vaccine, yung last mile namin, we invaded all social media. TikTok, Twitter, name it, we have it. So we even developed this, what do you call this? Parang emojis and sort of like that. But of course, that's really one target population. So remember, if we do this education or information materials, these really have to be market segmented. So a 9-year-old that goes to for example, Poveda or a similar school has a different mindset compared to a 9-year-old who goes to Fort Bonifacio Elementary School, right? Or those children living in a certain area in the city has a different perspective, perhaps, in 9-year-old living in Jida, in a geographically isolated municipality. So what I'm just saying is, one platform does not fit all, should not fit all. It should be market segmented, and I think it's what we should do now differently. Kasi usually if we post social media cards, we think it's enough. Kasi how about those not even using Facebook, right? Or how about those not listening to radio? So we should really have this market segmentation. So I think that's a term of, the pharmaceutical companies are using. So I think that's one thing. Second is, I think for the government to, not just the Department of Health, but also the national government agencies to not be afraid of involving, baka ma-news ako, private pharma companies. Like, I think through PHAP, because that's because we can't do everything, right? And HPV vaccine is actually very expensive. So, in my office, so I have like 2 billion plus budget for both mental health and cancer. So that's actually a glaring number for the legislators. So I don't think they will put in additional more budget if ganun na yung budget ko compared to other offices. So I guess it's really pushing the boundaries and making policies more responsive. Kasi yung mga policies natin, responsive, especially our fiscal policies. Thank you.
Doc and Grid, you want to say something?
Thank you for that question, because I really would like to float this idea. We have discussed this with the Department of Health. When you talk of cervical cancer elimination, can we look at it as how we did with filaria elimination in the country, malaria, and then so when we talk of elimination, can we not look at the country as a whole, but rather let's look at the whole, how many regions do we have in the country? 17 regions. So can we say that we can eliminate cervical cancer in this region? So let us now challenge our local government units through the DILG. Perhaps they can look at funding HPV vaccination, doing an intensive cervical cancer elimination in their region, and then say, okay, yes, we have eliminated cervical cancer in our municipality, in our province, in our region. And then consolidating all our efforts so that perhaps in the next 10 years, we can look at the country having a very low incidence of cervical cancer. I don't know. This is like we're putting this on the table for the government and then as well as the other partners to think about it.
Siguro my question for Doc Efren and Doc Demi naman. We have another question here. How do we make it possible for barangay and towns to disseminate cancer information? Tagalog daw sana yung sagot para maintindihan ng mas nakarami. And is this information about cervical cancer part of school curriculum, yung reproductive system? Paano po ba natin mas mapapakalat pa yung impormasyon tungkol sa cervical cancer?
Ang POGS, the Philippine Obstetrics and Gynecological Society Incorporated, mayroon po kaming programa na tawag na lay fora ng Women First. Isa po yun. Pangalawa, meron din kaming fora for Prepare, Reproductive Adolescent Health Education. At meron din kaming AHIP, Adolescent Health Initiative Project. So lahat ng ito, patungkol sa acquisition of the dreaded HPV virus at pati na rin po yung vaccination. Tagalog namin kinoconduct at ito ay involving ang mga ina, ang mga anak, ang mga teacher at that alone, if only magnified sa lahat ng mga iba pang sektor, hindi lang ang POGS, siguro po ay magiging malawak ang ating pag-educate at implementation ng advocacy and of course awareness. Apart from that, meron din po kaming tinatawag na community service. In the community service, kami pong mismong mga specialists gumagawa ng minimum of speculum exam. If only daw ang bawat babae ay isang best na speculum exam ang kanyang cervix and vagina and vulva, malaki na rin daw ang magiging impact nito sa control ng incidence of this cancer. Panghuli, gusto ko rin sabihin na yung KAP namin study noong 2009 with Dr. Castro and I, lumabas na ang pinakamahusay na source ng impormasyon daw, sabi nung naming study, is still the professional societies. Kaya dapat clear yung message ng professional society, for example, ng POGS, for example, ng Philippine Pediatric Society, kung ano ang gustong sabihin in the form of mga infographics or the tri-media. Pinapakinggan po ito pala ng mga nasa kanayunan, kung kaya't very important. Lately, nagkaroon din kami ng brainstorming kung saan kami nahuhuli patungkol dito sa drive against HPV. Lumabas na dapat daw emphasize natin yung gender-neutral vaccination. Hindi lang po sa babae, legal or FDA-approved, ibigay ang bakuna because ang dissemination ng HPV requires the most common intercourse which is heterosexual, dapat i-involve ang lalaki. So, yun, kailangan pa rin na masanib natin lahat ng iba pang professional organizations and societies sa paglagap ng effort upang mapatay natin itong cancer na cervical cancer. Salamat po.
Dr. Efren, it's nice to meet you in person dahil kasama mo na ako. No? Paano tayo? How can we work together? No? Ito na po ay sinasabi nyo. I have to admit, siyempre Philippine Pediatric Society, no? Meron kaming adolescent medicine, no? At meron din mga programang ginagawa. Pero kailangan namin siguro, no, ang isa is maghanap ng mga yung sa talagang grassroots level, yung mga sila mismo na ang hihingi ng impormasyon, no? So itong pag-dialogue is something na kailangan nating pagtuunan ng pansin kasi sa bawat chapter ng Philippine Pediatric Society, meron kaming mga adopted communities, no? Dito kami nagpapalaganap ng mga impormasyon tungkol sa mga infectious diseases, no? So siguro Dr. Efren, no, now na mention niyo po yung mga ginagawa niyo, pwede po tayong ma-intensify, no, kasi ito na po siguro yung naging opportunity na tayo ay mag-usap because a lot of issues po naka-cloud din, no? Dahil sa dami ng problema like mental health. You know, there are just so many challenges. So, palagay ko dun kami makakatulong at sana makahanap kami ng mga tao within the local government units kasi ang ginagawa namin ngayon, naghahanap kami ng mga pediatricians na miyembro ng Philippine Pediatric Society na kasama ng mga city municipal health offices. Meron na kami sa Taguig, meron na kami sa Rizal. So siguro doon pwede naming ma-exert konti yung influence namin para ma-intensify itong kampanyang ito. Thank you.
Okay. Thank you, ma'am. We actually have a suggestion here. Sabi niya, we hope that Makati LGU will be included in the 5 cities in Metro Manila to be provided with HPV DNA testing through self-collection as secondary prevention strategy for cervical cancer. Ayan, sila na yung nag-reach out din. Unfortunately, we don't have much time anymore. Medyo marami pang tanong. Pero siguro one of the last questions na lang is from PHAP. The NICA provides for PPPs, especially for non-PNF drugs. Do you now have the guidelines for such PPPs?
Not for PPP basically, but Vince is there, our staff, so he's developing the guidelines for, anong tawag nun, what we call spaces. So it's really convening everybody for us to access for our clients to access innovative medicine. So no pressure, Vince, pero nangangailangan na sila.
Okay.
But perhaps next year we're on staff work for that. So perhaps next year, but in the next months, our pharmaceutical division will be convening PHAP and other, I think, MSDs here, pharmaceutical companies to discuss this. So wait for the invitation. But you know, from our bureau's perspective, unfortunately, we really don't directly engage with pharmaceutical companies because of conflict of interest. We're the end user in the procurement, so yeah. So it would be through our pharmaceutical division. Thank you.
And lastly, we have a kidney transplant patient here with us, Miss Liberty Calya. She's asking, is the voice of patients included in the cervical cancer advocacy plans? If not, why?
Oh, yes, of course. Patient group is actually included even in the National Integrated Cancer Control Council. So one of our non-ex officio members is part of the patient groups, Ma'am Menchi Auste. That also includes in Mental Health Council. So we also have a member of the council from the patient groups, and even in our adult cancer sub-technical working groups and childhood cancer sub-technical working groups, patient organizations are included. In our upcoming strategic planning this June and July, we will also invite patient groups for this activity.
All right, thank you very much to our speakers again, Dr. Efren Domingo, Dr. Jan Liavado, Dr. Ingrid Magnata, and Dr. Fatima Jimenez. So I'll ask you to stay just a little bit longer because at this point, we are now officially launching the cervical cancer elimination movement. This movement is composed of cervical cancer stakeholders, including patient groups, medical societies and associations, academia, private sector, civil society organizations, government, and also policymakers. So this movement aims to discuss evidence-based and cost-effective interventions that will scale up the elimination of cervical cancer in the Philippines. And as part of the movement's first action, we have here with us our call for solidarity. Sir, call for solidarity there. And call for solidarity statement, which we will ask our guests to sign. And while they do so, allow me to read what the statement contains. I think they will bring the statement here so our guests can sign. Okay, so allow me to read a portion of the statement. It is time to take action against cervical cancer. We call on policymakers, legislators, policy leaders or political leaders, private organizations, medical organizations, and civil society organizations to work together to make cervical cancer elimination a reality in the Philippines. I think you can already start signing the statement. We urge family members and friends to support women in their cancer journey. Let's encourage them to get vaccinated, screened, and diagnosed. We demand that local governments include programs on cervical cancer prevention, diagnosis, and treatment in their health and development plans and investment plans. We encourage national and local governments to initiate the institutionalization of the National Integrated Cancer Control Act provisions on patient navigation, palliative care and pain management, and to support the institutionalization of the National Immunization Program, which includes HPV vaccination. We demand the allocation of separate and adequate funds at national and local government levels for scaling up HPV vaccination, HPV screening, and treatment of precancerous lesions and invasive cancer. We enjoin the private sector to implement cervical cancer prevention and treatment programs and policies, and to have an enabling cancer policy in their companies and workplaces. We ask PhilHealth to expand coverage and reach of the Z benefits package for cervical cancer and to also include HPV screening in the Consulta Plus package being developed. We strongly urge all sectors to continue collaborating and crafting innovative solutions to solve challenges and constraints involved in the implementation of cervical cancer elimination plans, programs, and initiatives. Together, let's make a difference and eliminate cervical cancer. Join our movement and help promote a safer and healthier future for all Filipino girls and women. So to all our guests here with us in the venue who also wish to sign the statement or the statement later, we will make this available to everyone after our event. So pwede po kayo pumunta sa harap to sign the statement as well if you also support the calls that we just made. But to everyone who are with us via Zoom or who are watching us on Facebook Live, we got you covered as well. Don't worry. We also prepared a change.org petition where you can sign to be part of the call for solidarity for a cervical cancer-free future. You just have to go to www.change.org/cervicalcancerfree. I think, do we have are we flashing we are flashing online a QR code that you can scan to go to that change.org page. Again, the website is www.change.org/cervicalcancerfree. So our target is to reach at least 11,000 signatures to give voice to the 11 women who die of this disease every day in the Philippines. Okay? All right, and with that, okay, but all right, so we're just having a short photo opportunity. Here, right there. Okay. Okay. One more. Okay. So before we go, we'll try again one more time the message of the WHO. The World Health Organization representative to the Philippines. Can we try that again? Okay.
Colleagues from the Department of Health, representatives from the Strat-based ADR Institute, JPIO Philippines, Cancer Coalition of the Philippines, Universal Healthcare Watch, Philippines Obstetrical and Gynecological Society, other esteemed partners and stakeholders, good day. Thank you for inviting WHO Philippines to the launch of the Philippine Cervical Cancer Elimination Movement. Cervical cancer is one of the gravest threats to women's lives. It is the second most common cancer among women in the Philippines and among the top priority cancers of the Philippine government. It occurs mostly in women in the prime of their lives. They may be raising children, caring for their families, and contributing to the social and economic lives of their communities. A woman's death is both a personal tragedy and a sad, unnecessary loss to her family and community. These deaths are unnecessary because there is compelling evidence that cervical cancer is one of the most preventable and treatable forms of cancer if it is detected early and managed effectively. To prevent cervical cancer, screening is an effective strategy, and WHO recommends using HPV DNA detection as the primary screening test in the general population of women and women living with HIV. Effective population-based cancer screening programs, which are organized and integrated, should be implemented in a stepwise approach. Hence, we applaud the efforts of all stakeholders involved in the scale-up cervical cancer elimination with secondary prevention strategy, or in short form, SUCCESS, that facilitated the introduction of accessible screening and early treatment for cervical cancer. Cancer prevention remains a priority of the World Health Organization, and since cervical cancer is largely a preventable disease, WHO supports the initiatives of the country to provide equitable access to human papillomavirus (HPV) vaccination, as this is an effective and feasible way to prevent cervical cancer. WHO Philippines reaffirms its commitment to the Philippine government through the Department of Health on Cancer Prevention and Control. Our team will continue to provide evidence-based technical guidance to implement strategic actions to reduce the cancer burden in the country. We also recognize the unwavering support and collaboration of various partners and stakeholders from different sectors present today. We commend the efforts of communities and civil societies for having a major impact in cancer policies and programs. Lastly, I would like to thank and congratulate the organizers of this event that reminds us of the important and urgent work that we all need to do to support and save the lives of people at risk and living with cervical cancer. I wish all of you a productive launch of the Zero Cervical Cancer movement. Thank you.
All right, thank you very much. And that ends our program today. So again, thank you to everyone who is here with us in the venue. Thank you for joining us in today's very insightful discussion. And to everyone also who is with us, who joined us via Zoom and Facebook Live. We hope to see you again in our next event. And just another reminder again for everyone who wish to sign the statement, you can go ahead and sign here in front, but we also still encourage everyone to share the change.org petition online. So if you have social media, you can share it on your Facebook, Twitter, Instagram, and maybe even TikTok, so we can encourage more people to sign the petition. Again, it's www.change.org/cervical cancer free. We are also showing you the QR code for the change.org petition here in front. All right? Again, thank you very much, and we hope to see you again in our next event. Have a good rest of the day. Everyone, we have snacks prepared for you, so don't leave yet. You can enjoy snacks, and we'd like to ask our speakers and reactors again in front to